Well, I got started in the femto market because I realized that this is the wave of the future, and certainly a laser can do a much better job of making incisions and customizing the procedure than any surgeon with their hands specifically. So that's what intrigued me about the technology.
If you think about what lasers have done to refractive surgery, what they've done to posterior capsulotomies, what they've done to so many things in our field, in other fields of medicine, that's what it's done to cataract surgery. It's got to be the most readily graspable element of cataract surgery to the patient. Great, it's now done with a laser. They get that, they want that, they understand that.
The undeniable advantage of a femtosecond laser is its precision. It can cut things with micron accuracy. A human hand, tenths of a millimeter. Well, what? We're not going to find that advantageous? Of course we are. There's no question that we are. The shape of the capsular rectus. Okay. Micron accuracy. Incisions in the nucleus. Same thing. Same thing. How can one argue against that?
Naturally, when we first adopted the LenSx laser for laser-assisted cataract, it slowed us down a bit in the operating room as we were adding this new technology to an already efficient center. As time has gone on and we've become more comfortable with the machine, and as the machine has been upgraded, not only is it not adding time to our procedures, it's actually speeding us up and making us more efficient. With the soft-fit patient interface and 2.20 software, we can actually dock, treat, undock the patient and get them into the operating room. Workflow is important to maintain that efficiency, and you'll get that as you become more experienced on the laser. So not only is the docking and treatment time quicker, but also because it does not have a fixed bed, it allows us to move the patients through this flow much easier. In other words, the patient can stay on the same bed from the moment they walk into the surgery center all the way through completion of their surgery.
Over time, we've become markedly more efficient as a result of having the LenSx integrated into the practice, because it allowed us to look at everything that we did. Now, that really starts with having the ability to take the patient in under the laser on a bed that they don't have to move from. Instead of getting up and getting down and moving around, we put them in a bed, we do the laser, they go in the same bed to complete the procedure in the operating room, and we do it in a way that for the patient now, once they get on the bed, they know that they're in the middle of the process, and when they get off the bed, they're done.
In my OR, the LenSx is put in the OR itself. We use it in the OR, so we do the procedure there, then swing the patient around to take out the cataract itself. And so we sort of kind of gauge how we do those and where we are, and so we make sure that the patient's ready, so they're brought in, everything's already in. I'm giving the information to the laser operator. All that's been pre-programmed into the laser, and so the patient's brought in, and then we place the lid speculum in and then dock them, set up the interface parameters, do the treatment, and then undock them. And for me, I'm in there about 2 to 3 minutes total time is what time that I'm in there interfacing with that procedure at that point in time to do that. Being able to bring the stretcher in and take the stretcher and put it under the femtosecond LenSx really makes it a lot easier, because then you don't have to put the patient on and off and then take and wheel the patient around, so you're easily just able to just maneuver them around. That adds to the efficiency with that.
The soft fit interface has been a great improvement, obviously one of the most tremendous ones in terms of patient comfort, patient acceptance, and just all of the outcomes that we see.
Just as the software and the hardware have improved, so has the efficiency. And that's to be expected. The laser does the job quicker. It does it in, 30–40% of the time it used to take.
My enjoyment from doing cataract surgery has increased. Then when you take that to the operating room, it's a challenge to integrate all of this and new technology into a system that has worked one way for so long. So yes, there's some growing pains associated with it, but it doesn't take long at all to figure out how you can make it work, and it was very successful for us.
We've really enjoyed having the ability to make our incisions using the LenSx laser. The ability to plan the incision, to alter the parameters, to grow them as we've learned has been amazing. The quality of the incisions is exceptional and has added a lot to the surgery.
One of the big things for me in trying to meet the needs of a refractive cataract surgery is being able to provide an arcuate that I can provide consistently and have reproducibility along that line. When I was doing the manual bladed arcuate, that I didn't feel like I was getting, being able to get consistency as far as being 90% or 80% and what OZ I was at to be able to handle that and have that be consistent. Whereas with the LenSx, I can set the arcuate. If I want to set the arcuate at a 9.0 OZ, I can do a 9.0 OZ. If I want to set it at an 8.0 OZ, I can do an 8.0 OZ. And so I can change that and put that wherever I want. And then the big thing to me, which was really key to me, was being able to have that incision where I could have that incision which would go down to 90% and be 90% all the way across and then come up. So I could control the length and the depth of the arcuate, which is what's going to give me my result. And if I can control that, then I'm going to get the consistency and going to get the outcomes that I want to provide for my patients in a cataract refractive situation.
With the LenSx, we have found that it has really met all of our needs in terms of what we need to do for our cataract surgery patients. Everything from making the incisions to being able to fragment the nucleus and being able to selectively alter these parameters on a surgeon-selected basis, and the flexibility that the system has with that has really added a lot.
Femtosecond technology it's noteworthy how far it's advanced in such a short period of time. It really is. But I think we scratched the surface. I think that it's going to do things faster, better, and more flexibly. Some surgeons want chops. Some surgeons want cylinders. Some want, grooves and this and that. And the sky's the limit.
So in any way we can measure, adding LenSx laser-assisted cataract surgery to our practice has helped us as surgeons be better surgeons. It's improved our patient experience and patient outcome, and it's ultimately helped the bottom line in our practice.
I feel like I can really finally deliver on those promises that seemed somewhat elusive before. I mean, we've had these goals for years of emmetropia, of providing a certain experience to patients, the reproducibility, the accuracy, and this is the first time that we've ever really been able to achieve those goals.